Welcome back, children of a lesser joint. I'm still talking about sarcoidosis. The last time I left off talking about the constitutional and musculoskeletal symptoms of sarcoidosis. Today I'm going to move into the skin manifestations or the cutaneous manifestations of sarcoid. And the patients present with a lot of variability in terms of the skin symptoms that they will have. On the bottom you can see what's called erythema nodosum as a possible association with sarcoidosis. It does occur in other diseases. On top you see what's called lupus pernio, which is a rash that mimics the raccoon type masking that you see in lupus. But there are a lot of different types of skin manifestations that can occur with sarcoidosis, anywhere from small papules to acne, rosacea type phenomenon, psoriasis, itchiness of the skin. Alopecia falls in here, hair loss, and there are hypopigmented patches and sometimes ulcerations of the scalp, just to give you an idea of the type of skin manifestations that we do see in sarcoid. Perhaps among the most interesting categories are the endocrine phenomenon that occur with sarcoid. And I'd like you to think about this, because oftentimes in sarcoidosis the prolactin levels can be elevated. Now, prolactin or prolactinoma, a tumor of the pituitary gland that's secreting excess prolactin, has been mentioned by Mike Gunson in the TMD literature associated with condylar resorption. Also associated with a prolactinoma and also associated with excess prolactin production as a result of a disorder like sarcoid, you can develop amenorrhea, cessation of your menses, and galactorrhea, which is abnormal lactation associated with prolactin production. You can also develop, as a female, mastitis, which is an inflammation of the breast, and inclusive with that is the fibrosis that can occur in the breast with dense fibrous tissue. Another phenomenon that happens in the endocrine system is the decreased sodium production. So we're losing sodium, and this can be associated with a couple of diseases. Number one is SIADH, which is another acronym for syndrome of inappropriate antidiuretic hormone, and I can test for that by sending the patient to the laboratory to get some blood and seeing what their arginine vasopressin levels are, which is the same as antidiuretic hormone. Now, we know about antidiuretic hormone from too much alcohol consumption. Alcohol inhibits antidiuretic hormone, and what antidiuretic hormone does is it helps you retain water. And so when we drink too much, we end up going to the bathroom an awful lot. I think that this is a really great place for me to stop today, and I look forward to the next time when I'll be rocking it out with Jaw Talk.